Tunes at the second hour. If you just tuned in, then good morning to you guys. Where basically we are introducing brand new tunes. Not only that, we're gonna do the Billboard's Top 10 countdown from the Billboard's Hot 100 for this week. We got days of the year, we got the horoscopes, and of course we are continuing the topic of the day, which is autism, with Dr. Juliet Dinkha now. Since we do days of the year, the first hour, didn't have the time for that, so we're gonna do it right now, just to have some fun with you guys. So today is the 3rd of April, and I'm excited for that. Today is Chocolate Mousse Day.
All right. I always wanted a day for that.
There is now an international day for chocolate mousse,
and
we didn't get any of the studio. I wonder why.
Oh, yeah.
It's not
really? It's not Cookies Day.
Chocolate chip cookies, so it's there. And because it's baked, it tastes like mousse. It's fine. Move on.
I always needed a reason why I need to eat chocolate mousse.
Now you have a reason.
I have.
You cannot miss this day not to celebrate it.
All day I will celebrate it.
Of celebration. Different kind of chocolate mousse that you can do. Today is Sweet Day as well. Today is the International Day for Fish Fingers and Custard Day.
All right. Fish fingers, I don't know, but custard, definitely.
Yeah. It's World Party Day.
Good.
World Party Day as well.
Oh.
And it's Find a Rainbow Day.
Oh.
I would love to find a rainbow.
I mean, we got some rain. You're going to find some rainbows, but...
Are we going to have rain?
They said it's going to rain, slightly rain at the evening.
Well,
so
then we can't see.
So there will be no rainbow.
No rainbows.
But,
geez.
one of these days that we just shared, you can definitely do the
We'll save it.
Chocolate Mousse Day.
Yeah, chocolate mousse. I
easier.
have something with my earphones.
No, you can hear very well. I
have a problem with my ears. I need an ENT doctor.
Next Tuesday, I expect we celebrate the Mousse Day.
Next Tuesday, I'm going to be sick. I'm not going to be here. From now, I booked my sick days earlier, 1 week prior. No, that's nice. That's nice, guys. But chocolate mousse is something really good. Of course, I wouldn't mind a nice place of chocolate mousse, Aki. So thank you very much in advance from you and from Dr. Juliet. The ball is in your court. So
we can do it. We'll deliver it to your house.
See?
Personally, I'll bring it over.
You should do it for us.
So this is what friends are about. Delivering, taking it to you. Don't worry.
Exactly.
I'll take care of it.
Thank you very much, Dr. Juliet. All right, so let's get back to our subject, Dr. Juliet. We were talking about autism since yesterday was Autism Day. So we talked a little bit about the symptoms, and we talked about when's the perfect age, or when parents should know that, for example, may God forbid, there's something wrong with the child to get them tested. So what do you have to tell us more about this?
Well, I do want to talk about what causes. No one really knows what causes autism, but but what we do have, research have said that partly is genetic. So if you have a genetic predisposition to autism, it means that it could be transferred from parent to a child. Now, there are also environmental factors that could be in effect that could cause autism, like stress or family issues that are like extreme. And it could also be a disruption of early brain development during the uterus. So when the mom is pregnant, if there is some sort of a disruption in the brain development, it could also cause autism. Now, like I said, nobody really knows exactly. We know that there's a higher percentage with genetic. All the other factors, it could or could not cause autism. Now, of course, there's a lot of other theories. Some people say it's the vaccination, all of that, but there's not really a lot of support for that kind of a theory as much as like genetic. And now what I want to talk about is also like people ask me, how is it diagnosed? Now for autism, there's something called CARS, which is Childhood Autism Rating Scale, and this is like a questionnaire that parents can fill out, and then when they're in doubt, they go to the psychologist or psychiatrist or even their regular doctor actually, and they can fill out this information, and you can score it, and the score kind of tells you that there might be an autistic kind of features, or there might be a diagnosis of autism. As you
said, they are in levels.
They're very much in levels. So so if you really are want to know how do I get my child tested, take them to your doctor, take them to a psychologist. or sometimes even teachers might notice, like
Yeah,
if they
yeah,
haven't
yeah.
been diagnosed earlier. It's usually between 3 and 17, right? Of course, we know that we know the symptoms earlier, but oftentimes we don't like to diagnose it until like
but now
about
with the
3.
new technology, I think there is a gene for autism. Where
If you want to test your gene, that's
you
right.
can test your gene and detect whether your baby is going to carry it
Now
or
there's
not.
everything.
Actually,
Yeah,
that's very
technology
true,
makes it
especially
easier.
if you have it in your family. I do recommend that. But the idea is that some people don't want to do that. But if you really want to do a gene test, right, you should do it to realize, especially if you know, like even maybe not in the immediate family, but if like you know somebody from the relative had it,
Then
or any
you are
other
prone to it as well.
or any other childhood development disorders, actually. So it
Yeah.
doesn't have to be autism. But so what you do is you could test the gene, and then you realize if you are a carrier or not.
Or not, yeah.
And then with the carrier, then you could decide if you want to start a family or not. I mean, it's it depends on you.
Absolutely true,
Now, how is it diagnosed? As I said, there's this thing called CARS, which is the Childhood Autism Rating Scale that kind of gives you a questionnaire, and then you can answer. Parents do that. And methods of treatment. Most times, people want to know how do you treat it. Now, once you get it diagnosed, and once everyone has, all the professionals have said that's it, you have. I recommend people right away starts looking into how do you treat it.
Yeah.
Now,
And also, I think it's very important, once you know that you're going to have an autistic child, is to prepare the
that's
right
right.
environment for your child. I mean, both parents must be mentally ready for it,
Yeah.
physically ready for it, and spiritually ready for it, and just to make
Yeah, of
the
course.
right environment for this autistic child that's going to come to the world. And that's why making an early checkup on yourself and on your child, on the fetus, just to make sure whether they're autistic or not, so you can actually prepare it all the way when they come to this world.
I mean, and nowadays it's like, we could do a lot of research,
Yeah.
and we know where, we should check into what treatment methods should we, what services can we have. Support
Yeah.
system is the most important thing, to be honest. If you know you're carrying a child that's autistic, you have decided that you will have this child as autistic, you really need to prepare yourself and really realize, let people know that you're going to need some support. Having some support, having some services, knowing where to take this child, because it can really be daunting and it can take a lot of your time. I mean, people have to make a change in their lifestyle. So if you are going to have an autistic child, or if it's been diagnosed as autistic,
Change your life
you
as well.
have to, and you can't just sit realize that this problem is going to go away. There's no cure for autism. What we can do is really teach this child or teach ourselves also on how to really work with the child that's autistic. And like I said, nowadays we've got a lot of times people say that, I want to take them abroad to get them treated. They need to have a specific teacher. It's true, but we also have that services here. You don't really have to make all of that adjustment, because once you take them abroad and have them sit there for a year, because the treatment is a long term.
Yeah.
And let's say at the beginning, a lot of times, I mean, I've known couples that have taken their child abroad but once you could identify a teacher that's going to work with them, a service that they're going to work with them, and then you have to interrupt them to bring them back, and then put them at a particular school here where they can get used to the
Especially
system
that
again.
You mentioned in the first hour,
They
that
don't do
autistic
well.
children,
Exactly.
They don't like to break their routine. They like things to happen over and over again, exactly in the same way.
Exactly. And once you teach them, some of the teaching methods is like you have to teach them how to have pictures so they can identify. When you're speaking to them, you always have to say, look at me in the eye, right? They don't use humor when you're talking to them, because they don't understand this stuff,
going on, yeah.
right? So these things you train them, but it's an ongoing training. And actually, the most successful family that I've worked with autism, the parents also learn how to work, not just drop them at the center and have
They
this
learn how to
individual.
work with them
You
and
gotta
be there
learn,
with
because
them.
their training continues even when they come home. How you deal with them, how do you discipline them, for example. What are the right things to use with them? Is electronics okay or not? Now, one of the common thing that people use for treatment is called applied behavioral analysis, right? And this is like a form of a treatment that they use so they can teach the child how to use techniques to get them to express themselves. But then any center that you go, they also have to have an occupational therapist and a physical therapist.
Yeah.
And those are, you got to look for somebody that can give you that kind of support.
Yeah.
The applied behavioral therapy with the physical therapy, it's all about conditioning, right? And OT, PT. they are conditioning your child on how to really use proper behavior. So for example, like if a child is not, the autistic child is not displaying proper behavior, they repeat it. And there's no punishment.
Yeah, we talked about
Yeah,
that.
there's no reinforcement. No, that they have to. No, the child is repeating, but we don't want them to repeat the same.
Yeah.
So we have to like make sure that they're not doing the same repetitive behavior. So in these kind of applied behavioral centers,
Then move away from their comfort zone so they can like interact.
and it takes time, and also it takes trust of the teacher. Usually they have a particular teacher that is very trained in applied behavioral therapy, and then they do. Here we have a couple of centers that really can help with that, and they also sometimes send a a caseworker or a specialist. They can work with you in the house.
To do that. Yeah, whatever is really good for your son or these kind of
They will do.
situations, that's what you have to do as a parent, and that's why we said that actually once you figure out by early detection if you are going to have an autistic child, you have to make everything ready before they come, because it's a huge responsibility.
Sure.
Now, maybe we should move on with the playlist. And
let's move on to the
we'll
playlist.
Be back, of course, with the horoscopes.
Yes, of course, we're going to be back with the horoscopes, and I'm going to share with you some celebrities that have autism. And they're fine with it. They're living with it. You're going to be surprised because they're big names, and I'm sure you know them.
Exactly. Moving on with the playlist, we're going to start the Billboard's Top 10 Countdown. That's the Billboard chart countdown for today. At number 10, you get Pray For Me by The Weeknd and Kendrick Lamar. At number 9, you got Freaky Friday by Lil Dicky. And at number 8, you got Camila Cabello with a song called Havana. Enjoy these tunes. We'll be back in a few minutes.
Billboard chart countdown.
I think your coffee is outside.
Yes, it's outside with the